Coronavirus vaccines are being rolled out on an industrial scale, in some places at least. For the head of the World Health Organization, major countries who've already secured supplies for their own citizens face a simple choice.
If the major countries agree to solve this problem, to address vaccine equity, they can do it. They have everything. They have everything to do it. So the political will is missing.
Major economies like the US and China have funded the WHO's COVAX initiative, which has delivered almost 40 million doses to low and middle-income nations. There are calls for that supply to be ramped up as soon as possible, but it's not hard to find stark differences between different countries and regions. Over the 7 days of this year's IMF-World Bank Spring Meetings, roughly 21 million doses will be administered across the United States. That's roughly half the number of doses delivered by COVAX to dozens of countries so far. Even as the world tries to reach herd immunity in this pandemic, there are already calls for early warning systems to be set up for the next one.
If you look at the trillions of dollars we spent in this pandemic, just responding to the health and economic issues, if we had spent maybe 100 or 200 billion on preparedness before that, we would have been better off.
In the meantime, the WHO says major economies threaten their own recoveries if they don't help developing countries. That's because there's no guarantee existing vaccines will work against new variants springing up in places where vaccination rates are way behind. Giles, Gibson for CGTN in Washington.